I'm thinking that I first heard about it on CNN, and it would have been around Christmas that they were showing lines of people outside hospitals in China and Wuhan. My ears were definitely perked up.
And then it was just all unfolding in New York. And I just quite literally would just sit on my couch and watch the news like all day long. And I would just cry a lot.
I just remember the first COVID patient was here in Vermont. We had a very long incident command meeting, and it ran into the nighttime. And at that time, there was a group of maybe 5 or 6 of us that went in the cafeteria, got some leftover food, and we had started having that conversation of what's it going to mean to treat patients? How's it spread? Because at that time, there was no good information really coming out about that.
Our patients are getting work in groups. They're within what we call the milieu on the floor, interacting with each other and staff, and all sorts of therapeutic experiences. So we knew that we have to be really tight in terms of how we're managing admissions, how we're tracking staff, in order to keep an outbreak from happening in the retreat during the pandemic.
In the beginning, those first early weeks, it was very unsettling to not have any more information than what the average person had.
Remember in the beginning, a number of us have children and we were told it'll just be 2 weeks and then they can go back to school. And it was a lot of anxiety around realizing we don't know when this is going to end. And the lack of consistent information was really unnerving for a lot of people.
One of the biggest roles of my job was to help navigate people's fear and so I was on call 24 hours a day. And so when we got the first patient, I was up on the floor with the nurses. I donned and doffed PPE to go into the room and help take care of the patient to show that it was safe to go in the room using the PPE that was needed. But it was more helping people know that they would be safe.
So I went to New York City pretty much the weekend that COVID exploded. And I took public transportation and I went to some Broadway shows and just kind of did the city stuff, but we thought we were being careful.
Actually, I ended up being one of the earliest patients, unfortunately, because it was around mid-March that I actually contracted it and thought I just had a sinus infection. And then on the day that I went to urgent care and went to the emergency room, it was like everything dropped off a cliff.
As COVID first entered Vermont, hospitals and health systems began collaborating closely, forging partnerships and systems that continue to this day.
When we first heard from other hospital associations, there were several that had a lot of conflict with their state agencies, but we didn't see that at all. From the very beginning, we had Dr. Levine communicating with us and we were working with AHS, and I think it really set the tone for coordination going forward.
There wasn't any trade secrets. It was kind of like, somebody would call from Springfield, from Rutland, from UVM Medical or something like that, and we would all share what we were doing, our experiences.
So besides the staffing, internal staffing collaboration, there was also collaboration with Department of Health, with our UVMC reference laboratory and other Vermont hospitals.
We learned from each other, constantly emailing each other, people in like positions. What are you guys doing with this? How are you changing this process? What's working for you? What's not working for you? Information sharing was huge. So it was definitely a time to be part of a bigger team.
As we were going through this, I'm thinking, I'm just a facility person. And, I really learned that I'm more than that. And other facilities people are, because we were involved with everything, every group all the way through from the testing rolling out to how do we figure out where these people are going in the building, to the security needs, to what do we need to look at for our air exchanges.
We had to research the CDC website to find out what was needed in terms of testing for COVID. It really was a lot of studying, a lot of collaboration, and a lot of talking to people all over the state.
In the earlier parts of the pandemic, the testing for COVID involved multiple different types of samples. We weren't always sure that we had the right supplies or that we'd be able to collect things. My boss came to me and said, "It's Friday, we need to have mobile testing up and running by Wednesday," and we did it. 3 days later, we had cars lining up and going through, and we were testing people, and the system worked.
We had to stand up our own contact tracing to try to stomp out small local outbreaks, and that was successful, but was a big lift.
So I didn't feel well, like for about a month. I just felt really tired and fluish, and I didn't have any sense of smell for about 2 months. April was like chest pain, side pain, and just that feeling of fullness that I didn't want to eat and I didn't want to really drink either. So everything that I was feeling wasn't necessarily reflected in what the doctors could see. So then it kind of made me feel like, well, maybe I'm a little bit crazy.
As healthcare workers grappled with the uncertainty of a novel pandemic, Vermont policymakers drafted emergency legislation to help the healthcare system provide patient care. To do that, they turned to a coalition of healthcare advocates.
We were asked by the chair of the healthcare committee, Representative Bill Lippert, asked us to come up with a bill that would have in it any flexibility that we were going to need for pandemic response. And so some of the smartest people I know got into a room with one of the lawyers who helps write legislation, and she's also experienced in healthcare, and we brainstormed, and between us, we were able to come up with pretty much every flexibility that ended up in the final bill, and then she drafted it. And we realized quickly that that group of people was going to need to continue to meet, and that there would be a lot of work for us to do together.
To make room for a possible COVID surge, hospitals took many steps, including canceling elective procedures, standing up temporary units, and adopting new safety procedures.
So first it was very dead here. The ER was dead, and people were staying at home. The surgeries were canceled. The preoperative space was opened up for the COVID patients that we were anticipating coming to the hospital, so we opened up a COVID unit.
We had physical therapy stopped, and our physical therapists took on full-time housekeeping roles.
Our respiratory therapists stayed in-house for patients that were pretty sick. Our anesthesia department stepped up and volunteered to be the providers that ran our ventilators if we had to put somebody on a vent for long term.
We developed surge models so that should our emergency department surge, we were equipped with almost a mini ER.
To deliver a patient tray down to the emergency room if they'd been there for a long time and needed to eat, or if the staff needed food. We had to call them and say, okay, meet us in the hallway.
What we did here at the retreat was move to virtual work for all of our outpatient work, which has been tremendous. So people are able to connect to their therapists and their doctors virtually, and it's been a great sustainer and help to people in the community.
So when there started to be outbreaks in skilled nursing facilities, it became clear pretty quickly that the best place to treat these patients would be in the skilled nursing facilities. So hospitals and skilled nursing facilities collaborated together to bring in staff and resources and help treat individuals where they were in their facility.
There were many more patients being cared for at home who were COVID positive than were being cared for in hospitals, often 4 times as many. Taking care of somebody with an infectious disease at home is pretty complicated. There is no way to control who else is in the home other than the patient, so a hospital can have a visitor policy that's pretty strict. Can't have that at home. PPE is donned and doffed in driveways and garages in home health. And people are using their personal vehicles to go from one home to another. There were national shortages of PPE, and so we worked together to try to get more PPE into the hands of our healthcare providers.
A supply of PPE had never been a concern of ours. So nurses, clinicians, people who use N95s would discard them after a use. Pre-COVID, post-COVID, N95 masks became like gold.
The hardest weekend for me with scarcity was the weekend I had to tell staff to continue wearing their same procedure mask for up to 2 to 3 shifts in a row. And I wrote that policy on a Friday and went home and cried all weekend. I just couldn't believe I was telling people to wear the same dirty masks for days in a row.
We needed PPE in-home health, in nursing homes. So there was, it was, I think, clear to policymakers that we needed it at hospitals, but I think those other settings, it was less clear.
So the Vermont Department of Health helped set up these regional hubs where they provided hospitals a STERIS unit to decontaminate N95 masks so that they could be reused up to 10 times.
We made arrangements actually to get some PPE shipped to us from China. There were families of students from St. J Academy that were concerned about what was going on and facilitated things from their end. The only thing I can remember about that is the shipping cost more than the PPE.
There was a concern that the N95 masks were going to be in shortage and that we didn't know if we'd take delivery of more of them. They partnered with Mac Molding to retrofit scuba masks, and then filters were attached to the top of it. Employees would actually wear that while they were taking care of COVID-positive patients.
Concept 2, one of our local businesses here, helped us through their purchasing stream overseas, and they got in several 100,000 masks and distributed them throughout our communities.
I had ordered some face shields and stuff to give to the ER because they really were the ones that needed, and it took forever to get here. And then Staples had a whole bunch, and they donated boxes to us.
We had a huge sewing circle. They made all sorts of things for us. That way we could hand those things out to people in our community, reserving those medical grade products for ourselves. It was really nice.
Unfortunately, PPE wasn't the only thing in short supply during the early days of the pandemic.
We need these, air scrubbers, these specialized size, and nobody has them. Or, we're trying to get these exhaust fans and nobody has them.
It was everything. Sometimes we couldn't get bacon. Sometimes we couldn't get chicken. Sometimes you never knew.
And then the shipping prices getting hiked up, that was eye-opening too. Things that we would get in 2 days for $100 less, and then all of a sudden, to a resource-limited hospital, that was pretty shocking at first.
Drugs like fentanyl and things that are very specific to patients on ventilators became in very short supply. So there had to be a lot of ingenuity by pharmacists across the country to create ways to make what we used to be able to buy before commercially.
Like everyday items, like coffee cups and stirrers and boxes and the strange things that there were so many times where I was like, this is weird. It's Amazon. It's America. Like, things just come. Like, where are all the things?
And I remember walking into Market Basket and being like, there's no chicken. And then being like, there's no pasta or pasta sauce.
I was out of paper towels, like legit. I wasn't ordering them. I really needed them. And I got to the store and there was literally like one 6-pack on the shelf, like a mile long. And I look around and I sprinted towards the paper towels. I'm like, this is what my life has become.
I loved avocados, and I'm a vegetarian, and I couldn't get avocados.
I just remember at that time thinking, it's really odd. Why would somebody want to have every can of peas? Nobody likes canned peas.
Well, I think the most common answer is probably toilet paper, right? I mean, that's the one everybody hoarded.
I think we were all surprised at the run on toilet paper.
We did pretty well with the toilet paper. I don't know how that worked out, but I happened to buy a big amount without knowing there was a pandemic coming. The shortages I saw was the ability to get some of my cattle slaughtered because so many people were getting their meat processed.
We couldn't get flour. And what was funny was that it wasn't that there wasn't flour, apparently, it was that there wasn't packaging for the flour. And so Red Hen Bakery, we live in Middlesex, Vermont, so Red Hen Bakery is a wonderful bakery in our community, and they actually made their flour available in bulk.
Our community really also was very affirming and encouraging to all of us here as healthcare workers. They donated meals, they donated maple syrup, they brought in Darn Tough socks, they sent us cards and letters.
One of our others was the local distilleries stepping up and doing 55-gallon drums of homemade hand sanitizers out of their distilleries. Your hands smelled like apples a lot, but we had hand sanitizer where the rest of the country was struggling for it.
As you can see, there's trees out here. All the trees were covered with hearts, and that was quite an emotional moment where the community came together and thanked us.
The way the staff here responded was very selfless, and I'm eternally grateful and appreciative for that. That, when you have a unit with essentially no backup, and someone gets quarantined for 10 days. And the rest of the staff, who's already at full time, just fills their shifts. I don't think that would have happened in a lot of places.
Watching the employees struggle with caring for these patients and then losing some of them was incredibly challenging. And knowing that every time they went into a room, it was challenging, but every time they went into a room, they were providing care that was necessary.
Seeing the transition of a patient who comes in and they're breathing and talking, and then they end up in the ICU within a couple of hours because they can't breathe.
The sick patients in the ICU, that's who requires a lot of time and care. And there are people that get better within a couple of days and come out, and that's very exciting. And then there are people who just don't get better.
So it depends. A lot of the times when we're getting to the point where the patient is needing to be intubated, they're really struggling to breathe. So there's often more fear than anything. They're definitely afraid. But in there some cases that patients are lethargic, so they're actually not aware of what's going on.
I had been seeing, the reports prior to my getting sick about people needing to be intubated, and I didn't think much about that one way or another. But I knew it was pretty serious when, so long as the oxygen level kept going down, they had to do something. And I just was resigned. I was one way. I was either going to live or die, and they had to try something. Otherwise, I wasn't going to do any. I wasn't going to make it. That's for sure.
Seeing the fear in their eyes, it spilled over to us. We weren't allowing visitors, so we were their family in this time. Being with them, not being able to have them see our mouths or our facial expressions, and talking to them through big suits.
That was probably one of the harshest thing about this entire pandemic is you have the sickest people and they can't have anybody visit them. And that's detrimental to the patient, that's detrimental to the families. I mean, it's heartbreaking.
The level of suffering that we've seen. We have patients that can't have loved ones with them. We have patients that are at risk of losing their life and their family can't be here. We've held the telephone to FaceTime prior to intubating a COVID positive patient, knowing that that's probably the last time they're going to talk to their family member. That takes a toll on you.
I see how brutal this is, and in my entire career, I have never seen anybody struggle so hard to breathe, and it's devastating. And I've done this for a long time, and I've never seen people struggle like they do with COVID.
That image of when I woke up, I came out of that, and just seeing all of them around me, you could just see the relief on the doctors and nurses' faces when I woke up. It was like, yeah, we got one. We made it through. Because at that time, it was pretty touch and go. There weren't too many who made it through in those early days.
As hard as it was to care for COVID patients, healthcare workers also struggled to care for those at home, especially as schools closed.
That was even more challenging for us in our personal lives, was trying to anticipate what we were going to do for childcare and what we were going to do for the school system that was open but then closed and maybe going to reopen but then didn't.
Kids rely on our schools for food, for mental health. A lot of the Vermont Care Partner services are provided in schools. And when kids are there, we can get to them. And kids need their teachers for support. They need their counselors at school for support. Schools are the heartbeat of many communities. And when they closed down, a lot of communities really felt it.
So I am a mom and a wife, and my husband is a teacher, so we were very fortunate that he was able to be home when schools shut down. But knowing that I was facing COVID patients and knowing that at that point there was no vaccine and knowing that I had to come home to them was some of the scariest times that I've ever had as a nurse. The stories that you hear about nurses, taking off their scrubs, outside and then going straight up to shower before they hug their kids was real, and that was something that we did at my house.
It was exhausting. I couldn't be the mother I wanted to be, and had everything to choose to devote to the mission or be home. And so I chose the mission.
We had some individuals that opted to send their littles to grandparents or aunts and uncles, and went weeks and months without seeing their children. We had staff that had to make hard care decisions. Do they resign their position and protect a vulnerable loved one at home, or do they relocate and sleep at the hospital or stay in a hotel room?
My childcare was amazing, and she closed down to all families except mine. So she took care of my kids while I worked a lot of extra hours. It was a relief to go home at night and to be able to escape the reality of the workplace through my children and their innocence.
As Vermonters endured a holiday season isolated from all but their household members, good news arrived in the form of vaccines, which Vermont rolled out more successfully than any other state in the country, first to healthcare providers and then through age bands, beginning with the oldest Vermonters.
In February, they decided, it was rolling out to the greater community, they decided to create a vaccine hub. And I was fortunate enough to be asked to lead it. So it was over at the old JCPenney's at the mall, and together we did in that hub 25,192 shots. That was really, honestly, 40 years of nursing, my most gratifying work ever. We called it the happiest place in medicine because everybody was happy to be there. We had one woman come in and she had like 5-inch stiletto heels on, bright pink, and she was dressed to the nines, and we're like, wow, where are you going? She goes, right here. This is a big event and I'm dressing for it.
Besides being the lab director, one of my other hats was being on the Council on Racial Equity. And that council had looked at the data around Vermont and realized that many Black, Indigenous people of color were suffering a lot from the COVID pandemic. And so when the vaccine was given here at Brattleboro Memorial Hospital, I volunteered to be one of the first so people could understand it's safe and that it's okay to have the vaccine and protect your family as well as yourself.
The second portion of the vaccine was like, Dr. Kaminsky called it like a reboot of my immune system, and that's exactly what it felt like. My body it rebooted. It was like, oh, I know what to do. And all of these issues like phantom smells and the exhaustion and headaches and, chest pain and short of breath, all of those things, they just kind of like sorted themselves out and went away. It was amazing.
The proudest I've ever been to work for home health was during our vaccination effort. We knew early that we had many patients who were homebound, who were desperate to be vaccinated, who had not seen almost anyone during the pandemic, who were incredibly isolated, and who were not going to be able to get to vaccine clinics. And I think Vermont understood that need before many other states. And so we were part of the planning much earlier than we saw in other places. And it was a combination effort between home health agencies and EMS.
We were tasked by the state to do at-home vaccinations for those who were housebound or infirm, people who couldn't get out and get to any of the clinics. The state approached us at one point and said, well, how many people can you guys do at once? And we came up with this idea of doing a mobile vaccination clinic. We're at Thunder Road in Barrie. Some of the people who come early know that we're here and they want it. Others have been quite reluctant, and we have to kind of convince them. Why should I get it? Why? Because you care for your loved ones, because you don't want them to be sick. You certainly don't want to be sick yourself. And you also have an obligation in society to contribute to society. And by virtue of getting a vaccination, you make everyone else safer.
We feel very angry, and I think it is the right word to use when we have patients who got infected by unvaccinated anti-masker family members that came to visit them or something like this, even though the patients themselves did the best they could to protect themselves from COVID exposure?
It's just really frustrating to care for the people who have chosen not to be vaccinated because they are so sick. Most of them are remorseful because now they're in this position. And it's a burden. It's a burden on nursing. You know, we're in a bad nursing shortage right now, partly as a result of all this. And it's just making it worse.
None of us asked for this pandemic. None of us did. But here we are with this huge learning opportunity. And it's a good time to take stock of, okay, how am I getting through this and what do I want to hang on to?
I've seen a lot of families struggle with losing their loved ones through this, and it's heartbreaking. And so going forward, I'm not going to take anything for granted because I know it's just one moment. That's all it takes.
You know, I think the thing I've learned is to really try to appreciate everything, because I didn't know that I should appreciate being able to get together with friends, that's a thing that we could lose.
We didn't have a flu season last year, and it goes back to hand washing, social distancing, and wearing a mask. It would be nice if society learned those lessons going forward and took some responsibility to be kind to their neighbors.
Vermont is a collegial state with a lot of trust in public institutions and local government, and it became easier to get the population to do the things we needed to do to control the spread of COVID. It was easier, as is reflected in the vaccine numbers, to accomplish what we needed to make all of us safer, and that's borne out nicely.
I think that the people who live here should feel very blessed and very lucky to have experienced what has ultimately been the best or lowest rate of infection in the United States over the course of this pandemic.
As a hospital, as a community, and as a state, we've learned so much. Again, it comes back to how we collaborated. You know, a lot of different states see their hospital systems as competitors. I'm so proud of the fact that here in Vermont, we're not competitors, we're partners.
We are all in this together, and we will weather this next phase or whatever these next phases are, and we'll do that because we're a team.
Vermont PBS, partnering with local filmmakers to bring you stories made here. For more, visit vermontpbs.org.